Well, Mission of Mercy is the signature humanitarian outset of the call to care. It's set up to help the underserved in the dental area and now eye care.
Mission of Mercy is an entity, an organization that has done a phenomenal work in really helping to serve people right where they are.
It's core to what we do. It's part of our mission, and so I've been happy to be a part of it for the last several years.
The mission is really focused on getting free dental care to patients and folks in the Allegheny County area, the Western Pennsylvania area, that have no access to good quality care, don't have insurance, maybe homeless. Those folks that just don't have that opportunity to get the quality dental care they need, which is so critical to their overall health.
Mission of Mercy is an extraordinary program. I think the needs that are in the community are represented by the numbers of people who are in lines, the numbers of extractions, the number of free eyeglasses.
Great, to walk in and see all the different sponsors of this event, all working together to make this happen.
One of the things that I feel is most powerful about our mission and what we do is we certainly give the dental care that people need, but all of our volunteers treat everybody with dignity and respect, and that's something that really is a very positive feeling.
For those that like to really be out there in the community and helping, it's so uplifting. It's so powerful just to be able to see people's faces when you're doing so much for them.
I'm so grateful that I can volunteer and I have the time to volunteer and I can help everyone. It just makes me happy that I can help people. My heart is already warmed and I've only been here for a few hours.
Everybody here has been so incredibly kind, patient. They treat you with such dignity and respect. I would say definitely don't hesitate. You're really missing out.
And I was in a lot of pain and no one would help me, even the emergency clinic.
Obviously with COVID affecting all of healthcare, there's been a backlog of oral hygiene and now eye care. So this is like an oasis in the desert for a lot of these people.
Thank you. I mean, that just sums it all up. Because some of these services, there's no way you can afford it. You go, before I came, I might have been 6 months with that mouth pain. I was in tears, literally.
The time is necessary for us to help restore and give some positivity back to the community.
I've been in dentistry for 34 years, and I enjoy what I do. I love my occupation. But to be able to give back to the community is really a blessing. I look forward to this every year.
It's such a privilege to think that without the organization, I couldn't help anyone. But because of Mission of Mercy, I can help maybe 7, 8, 12 people. It's a privilege.
And so I thought this was a great process to be able to help not only people in the community, but our veterans specifically.
I'm a veteran, so I go to the VA for most of my health care. Unfortunately, my teeth are not service connected, so they don't cover that. This bridges the gap for me. This is pretty awesome.
It's very valuable to any veteran, to anybody, put it that way, who's not medically insured.
I would recommend this to all my veterans buddies, and I probably will be when I get out of here.
All in all, if it was a 1 through 10, I would give MOM a 10.
Don't worry about it. Don't be ashamed. It's free. It's good. And why not come and get some free work done?
It's easy to become cynical. It's easy to become tired. And these kinds of outreach missions, they're our antidote to cynicism. Prevent ourselves from losing sight of what it is we're all here for, which is to help people.
It's a blessing like no other. I couldn't afford this otherwise, and eventually it would have led to a lot of complications. I can't say how appreciative I am to the doctors, all the volunteers, all the staff here. It just means everything.